we want to take a moment to talk about a milestone in our collective history. Today marks 4 years since the World Health Organization declared COVID-19 a global pandemic. At the time, our lives were put on pause. Quarantine began. WFH, who knew what that was, right? Well, work from home became a thing. School was canceled, businesses were shut down, too many of which would never reopen. And around the world, many people lost their lives. This morning, the latest variant, JN.1, is dominant here in the U.S. Houston's Chief Medical Officer, Dr. David Persse, is here to talk about COVID-19 and where things stand 4 years later. Good morning, Dr. Persse.
Good morning. Thanks for having me.
Absolutely. So let's talk about the latest data on COVID-19 here in Houston.
Well, here in Houston, we still get reported cases. The numbers are way down, as you can imagine. And actually, for this past week, for the first time in a long time, we actually have no new deaths to report. Now, for quite some time now, the numbers have been very small, but we continue reporting deaths, which is tragic. But actually, this past week, no new deaths. So I guess that's really good news. For the first time in a long time, no deaths.
Yeah, that is really great news. Okay, talk to us about the CDC. I know the CDC recently updated its isolation guidelines for COVID-19 and other respiratory issues or viruses. Can you provide more details about this and how people can protect themselves amid these changes?
Yeah, so one thing that the CDC has done is they've tried to simplify it. So the new recommendations are that if you've got a viral illness and your symptoms are improving for 24 hours and you've not had fever for 24 hours, but a little caveat there, you can't cheat. So, no taking acetaminophen, no taking ibuprofen to eliminate your fever. So no fever without any medications, and your symptoms are improved for 24 hours, you can then go back to your normal activities. But even when you go back, you still need to wash your hands a lot. You may still be contagious, right? So, physical distance is good. Try to stay away from the crowded areas because you don't want to get anybody else sick if you can avoid it.
Yeah, absolutely. That's the goal right there. Okay, let's talk about long COVID symptoms. Yeah. This is something that so many people are still battling today. What are some current treatments available to those people fighting long COVID?
Yeah, that's a great question. And one thing is that, with COVID, it has behaved differently from so many other viruses that we usually deal with, even with other viruses in the coronavirus family. So, for example, there are a number of cold viruses that we've been dealing with for decades that are in the coronavirus family. And, we made some assumptions when this new COVID-19 came along that it would behave similar, and it has not. And one of the big things, as you point out, is this long COVID, which remains really a mystery. We really don't know what's causing it. People who have it very often they're very different symptoms. There is no one therapy that seems to be working well. In fact, the one thing that gave us some hope was that some folks, if they got vaccinated after they had developed long COVID, were diagnosed, so they got another vaccination, that their symptoms were improving. And some of them it went away, and some of them it just got a little bit better. So it remains a real mystery, long COVID, and we haven't unlocked that box yet.
Let me ask you this: 4 years into this, do people have some form of immunity at this point?
Yeah, well, yes. So I'm going to say I assume so. We're not doing the testing that we used to do where we would, get a couple thousand people and test their blood to see who had immunity or not. But I'm going to assume that at this point, you've either been vaccinated or you've caught the virus. The virus, COVID, is, it's become such a huge issue because it's spread so easily and so quickly. So for somebody at this point to have not at least been exposed to the virus, even if they didn't get vaccinated, I can't imagine there's very many of those people left. And that, in fact, is why we're seeing across the whole population, why we're seeing so many fewer people requiring hospitalization, because everybody now has some form of inherent immunity, either from vaccination or from previous illness.
Yeah, that's really good information. Good to know. How are scientists working to prevent another pandemic from happening moving forward?
Yeah, so that's another huge challenge. And the reason that I say that is that if a virus that comes on the scene becomes pandemic, just like with this COVID, because when none of us had any immunity to it. So when the entire population has no immunity and all of a sudden you introduce a new virus, it can just spread like wildfire. And our only ways to defend ourselves in the beginning are hand washing, social distancing, not going to large gatherings. And those things work. And I want to remind folks that we know that they work because during the years when we had COVID, we had almost no flu. We had almost no RSV. Those basically went off the radar. But COVID was able to spread like crazy because none of us had any immunity to it. So those things do work, but when there's no herd immunity, the new virus will take great advantage of that. So as we look forward to the next pandemic, part of the problem is we don't know what the next virus is going to be. But what we want to take from what we learned with COVID is those things that work. And one of the big tragedies of it is that, this became politicized, right? And there are people who became angry about the vaccine issue and became angry about mask wearing and social distancing. And, there's no perfect answer. These all are layers that build one upon another. And when it became an emotionally charged issue, we really suffered in this country compared to some other nations. And so as we look forward to the next one, I wish I could figure out a way to avoid making this such an emotionally charged and polarized issue.
Yeah, this I think proved to us that nothing's really black and white. There's a lot of gray, and certainly with the pandemic, there was a ton of gray. With that said, as you know, today marks 4 years since the World Health Organization declared COVID-19 a global pandemic. Dr. Persse, bring us back to what you were doing, if you remember, 4 years ago today. What was going through your mind? What were your efforts? What did that day look like for you?
Yeah, so what I remember was I was a little bit frustrated, quite honestly, with the World Health Organization that they hadn't declared it a pandemic
sooner.
Yet. Yeah, it was pretty evident that it was a pandemic, but they had their reasons, and I respect that. But it was a little bit frustrating because when it became declared a pandemic, I felt at that point that was going to give us an advantage in being able to get resources, to get people's attention, to coordinate efforts. And to a large degree, those things happened. They, of course, didn't happen as quickly as any of us would have liked. But once it became declared a pandemic, the political landscape changed a little bit, and we were able to start getting some resources that we so desperately needed. So that's my memory of this day 4 years ago. Is finally they declared it a pandemic. Now let's get to work.
Right. Let's get the job done. Okay. As always, we appreciate your time, sir. Thank you, Dr. Persse.
Thank you.
Thanks.